Hello, my name is Kenneth Thompson, and today I'll be discussing how to measure skin folds, as well as what to do with that information once we collect it. So there are 7 sites for skin fold testing. There is the chest, subscapular, tricep, mid-axillary, abdominal, superiliac, and thigh. And playing is going to be a video of me going through the 7 skin fold sites with my volunteer Kylie. So starting off, we have the chest skin fold site, which is a vertical site measured to the top of the shoulder to the nipple, halfway for men and a third of the way for women. Next one we're doing is the subscapular, which is a diagonal fold 1 to 2 centimeters below the inferior angle of the scapula. The next one we are going to do is the triceps, which is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the elbow, the arm held freely to the side. And you can see here I have her make a fist and punch down to make sure I'm only getting fat and not muscle when I make that pinch. Next we are going to be doing the mid-axillary, which is going to be at the height of the xiphoid process, a vertical fold that is taken at the midline of the body. Next one we're going to be doing is the superiliac, which is a diagonal fold in line with the natural angle of the iliac crest, and it's taking just superior to the iliac crest. The next one we are going to be doing is the abdominal skin fold, which is taken about 1 to 2 centimeters away from the belly button. The last one we're going to be doing is the thigh, which is a vertical fold on the anterior of the thigh, halfway between the patella and the inguinal crease of the hip. And as you can see, I've already marked all of these sites as well as the pinch sites on my volunteer here, as you can see. So I'm going to be going through all 7 of these sites one more time. That is because you have to take each site a minimum of 2 times. If those 2 results are within 2 millimeters of each other, then we can move on with that information. However, if they are not, we must do a third skin fold pinch, and if 2 of those 3 are within 2 millimeters of each other, we can continue with those 2. Another thing I would like to mention is they're always done at the right side of the body to make sure it is consistent in between multiple attempts at taking these skin fold sites. Another thing I would like to point out is my elbows are always up when I do this, and I always hold the skin fold for at least 1 to 2 seconds before I try to measure it. Also, when we are taking our second and possibly third skin fold sites, we always allow some amount of time in between so that the skin can regain its normal texture and thickness, because it does get aggravated with the pinching that we do. When we are taking these skin folds, we make sure to measure about halfway of the pinched skin. So halfway between the non-pinched skin and the top of the pinched area of the skin. And it is important to know that you are fully pinching them. You're trying to get only fat and not muscle. So it is not a comfortable process for the volunteer. Because of that, I would like to say thank you again for my volunteer Kylie to subjecting herself getting pinched multiple times. Now, these are Kylie's measurements. We take these measurements, and as mentioned earlier, we have to make sure that they are all within 2 millimeters of each other. And if they are, we can continue. We then average the measurements together, and we take a sum of those averages which for Kylie was 90.5 millimeters. Then what we can do with this information is plug this into a body density formula. There are multiple different body density formulas, but the one we'll be using for Kylie is the one for 7-site skin folds and for women. So plugging in the sum of 7 skin folds, which is 90.5 millimeters, and her age, which is 20, we get a body density of 1.0565. We plug this body density into a body fat formula, and we get a body fat percentage of 18.5227, or if we're telling a client, we can just say 18%. It is also important to know that this is a calculated measurement. This is not her true measurement, so it can vary by a couple percentage points. So, what do we do with this information? One thing we can do is telling the patient, this is your body fat percentage, this is a healthy amount of body fat for your size and weight. You're perfectly healthy, or you're not perfectly healthy, and here's what we can do to get you towards those healthier levels. Another thing we can do is to track a person's progress along the exercise regimen or as they advance in age. Because as a person advances in age or progresses with the exercise regimen, the total amount of body fat percentage and the distribution of that body fat on the body would also change.